computer. All right. So we're moving into the intestinal nematodes. So, surprise, surprise, few of you have already witnessed these eggs. Great, all right? So you're ahead of it. So you're going to see some familiar eggs when we put them up. We're going to go through their life cycle. It's a little different. So, but by this point, you should be kind of familiar and ready for the bumps in the road as we change. Some of the pictures are gross. Go ahead and tell you that. Got some really graphic pictures of some parasitic infections. And just to say that these like to make appearances in your lower end, and that's how we usually know they're around, is they actually will make an appearance before you know they're there. All right, so intestinal nematodes, so that means they're going to be located in the intestines, but you're going to see they have other places they like to go to do certain things, and it's pretty gross, but it's the way it does. So we have poor sanitation is a lot of this. So the intestinal worms come from poor sanitation, meaning that you're getting either animal feces or human feces ingested to be the host for these. So the first one is Ascaris lumbricoides, and we are familiar with that name. We shouted it in lab a couple of times. It is the human roundworm, as it's known, and the infective stage is an embryonated egg. So it has to be an embryonated egg, which is a fertile egg. This infection is transmitted through the ingestion of contaminated food and water, which we just said earlier. The larvae hatch in the small intestine. Okay, that makes sense, right? We take the egg in, we ingest it, it ends up in our intestine. It hatches there, it penetrates the intestinal wall, so it's going to exit the intestine. Remember, the intestine is basically an external tube within inside the body. So now it's internal. Like if it goes through the intestine, now it is internal to you. It's going to enter the bloodstream, and they're carried to the lungs by the bloodstream. Yes. So once they make it to the lung, they're going to enter the alveoli through the pulmonary capillaries. They're going to grow there. They're going to molt there for a 3-week period. So after you've ingested it 3 weeks prior, now it's in your lungs. They're going to then migrate up the trachea out of the lung. Now, this all started with you swallowing them. They're going to enter into from your trachea, windpipe, and they're going to go back down the esophagus. Okay, so maybe you cough at that point, and maybe you swallow after you cough, right? So they're going to find their way back into the intestine, where they mature into the adult once they get back to the intestine, and they mate. So that's where the mating occurs, is after this migration. So after mating, the female begins to produce eggs. Everybody with me so far? Pretty simple, right? The eggs produced in the small intestine are now able to pass out of the body of the host through the feces. The female worm may produce as many as 200,000 eggs per day. So you are a walking, breathing, talking eggplant, and you are scattering those wherever you pass feces. It's been estimated that 18,000 tons of eggs are produced annually by worms infecting the population of China alone. So, since we do have visitors from China, Zichong, what do you think of that? Is this a Ascaris lumbricoides? Are you familiar with this parasite? Okay, good. Didn't want everybody to think that Okay, so we throw China in there sometimes, and we have them here, right? We have China citizens here. We can ask. So here is our CDC life cycle. The Ascaris lumbricoides, of course. Whichever way you want to start, we'll start with one. Where's one? One's here. Diagnostic stage, we get a female or male worm. Okay, you're going to see that the male has this hook to his tail. We'll see that in just a minute. So that is in the feces. That is being defecated too. So that you can find these in the feces. Okay, diagnostic stage. So it's also going to be eggs, and here's that, you know, pine cone look. Everybody's seen a pine cone, hopefully, fall from a tree before it opens up, and it's that hard shell to it, and that's kind of what this resembles. The unfertilized is not as round as the fertilized egg. It's more football shaped. The fertilized egg is then passed through the feces, and then it is ingested. So we can do both ways, right? So here we've got an egg being ingested. The infective stage is the fertilized egg, the embryonated egg. You've got a baby in there, okay? Hopefully you can see that. That goes down back into the small intestine. The small intestine invade. They break out of the small intestine. As immature, they go into the lungs by way of the bloodstream, get in the alveoli for 3 weeks. They mature there. Okay, then they migrate up the trachea, right? There's the trachea, yes. And then they're swallowed back down. The esophagus is green, back into the stomach, back into the small intestine, and keep the thing going. Pretty neat, okay? I know it's not blood bank, but it's pretty neat, right? Mammaliated egg has a bumpy appearance. That's that pine cone outer albuminoid coating. The fertile eggs are typically round, which we just said. They have a thick inner shell covering an unembryonated egg mass. Then they decorticate. And I think we talked a little bit, some of you in the lab, about decorticated eggs. These are the eggs that lack that pine cone look. So they smooth out. They're not as rough. They have a smooth outer coating. And they closely resemble the hookworm egg, which we're going to see here in a little bit, and have been misidentified as such. So all of a sudden we're getting eggs in the feces, and we may have to determine if it's decorticated or if it's hookworm. Infertile eggs are long and narrow like a football. The decorticated infertile eggs resemble Trichostrongylus eggs. The diagnostic stage for eggs is fertile or infertile or mammaliated or decorticated. It can be any of that. And then we can have the adult worm, male or female, being in the feces too. So what about the male adult roundworms? The size, 8 to 14 inches, right? We could say 20 to 35 centimeters, but if you're like me, you're probably like, well, what is that, right? But 8 to 14 inches, you know, that's close to a foot long, right? Thickness, 1 centimeter. The male, less than 30 centimeter. They're more slender, and then they have this incurved tail, and that's a distinct male characteristic of the male adult roundworm. Creamy white, very tough, circular striations. So here's our picture. Who wants to say which one's the male? The one on the right. The one on the right of the other with the cooked tail, right? So here's that characteristic incurved tail. There we go. This is holding some Ascaris lumbricoides. I think we always put these out for high schoolers to come see. We have some in a jar. So let's look at the eggs. Fertile or infertile? Again, side-by-side comparison. Fertile is round, oval. Infertile, long and narrow. So the size, you would, infertile's bigger. Operculum, none for both. We'll talk about the operculum as we continue on with egg descriptions. Shell thickness, very thick for the fertile, very thick for the infertile. Embryonated, no. Okay. Color, brown. Bile color, mammaliated egg with thick shell. So we're going to see some pictures in just a minute. If the egg is unembryonated when passed, which are unembryonated when they pass in the stool, they require a period of 2 to 3 weeks of development outside the body. So where is that happening? That's happening in the soil or wherever the feces has landed. Okay, so there is a time period of and what's the infective stage? Embryonated egg. Okay, so you're not going to infect the next host if the egg has not embryonated before it gets into the next host. So outside the body, the eggs are killed by excessive heat, dryness, but remain viable for months in warm, moist soil. So here it is. Some of you have seen this one already. That's that pine cone look to it, that outer shell. There's our fertile egg, round. This is decorticated, all right? Lost that hardness. That looks like an embryonated, looks like a little worm inside. Again. This is the infertile. Still has the outer shell, but look how it's long and football shape. So the disease state for Ascaris lumbricoides is small amounts of eggs. If you had that, you're asymptomatic. Large number of eggs ingested, you get infection of the lung, pneumonitis. Few adult worms, asymptomatic. Large number of adult worms may form a bolus causing intestinal obstruction, possibly leading to gangrene and death. So these can do what? They can stop up your intestines. That's how thick they can grow in numbers. And we have some really graphic pictures coming up of that. So here it is, your warning. Due to the graphic nature of this program, viewer discretion is advised. Did I ever tell you the story about me and doing paramedic training? Did I ever tell you that story? I haven't told you that story yet. Have I told you this story? Or are y'all just shaking your head and yeah, he's told it, so let's just kill some time. No, the story is that when I was in college, I took first responder. So it was teaching us, basic first aid. If we're the first one onto a scene, how do we assess it and all that good stuff. So it was kind of like the pre-paramedic class. It's kind of like, take that, and then you're going to go to paramedic. If you want to be a paramedic, you keep going. So I remember sitting in there, and of course, it's a room full of, students, and I don't know everybody yet. So that came up, like he's going to turn the lights down, and he said, okay, you're going to see some graphic, like, pictures in the slideshow. Some, in the past, some students have gotten queasy and maybe think, faint and all that. So I'm sitting there going, well, what does that feel like? How am I going to know I'm about to faint? That'll be real embarrassing if I just fall out of my chair fainting and I didn't know I was going to faint. So I'm like watching the screen and feeling for a palpitation or skip. I'm just thinking, I've never fainted watching something, but he said there's a warning. Hey, this could make you. So that being, I don't think ours are that bad, but his weren't either. I mean, they were just you think he was going to show us some scenes from accidents of real accident victims, but it wasn't too bad. But I did learn one thing. I'll leave this with you. That one things we talked about was one of the major causes of accidents, like damage to you in a car when you're in a wreck, is your visor. That sits right here. Talked about how that scalps a lot of people when they crash and their head goes up toward it and it's sitting there and it's a little metal blade and that little thing that's flipped down. So just give you something to think about. So wear your seatbelt. All right. I don't want any of you get a cut across your forehead because you hit the visor. You hit the visor because you weren't wearing your seatbelt when you crashed. All right, so here's our intestinal worms. They're all blocking that intestinal section. So here's one, you know, a nice endoscopic view of going. That looks like what? What does that look like? Trachea, yeah, you see the rings and cartilage there. Good, my A&P people that paid attention in A&P. This is, yeah, this is not good, right? This is pretty graphic. I don't think that's staged at all. I think that's really a patient. And this is another section of the bile that's turned gangrene probably with blockage, and it was like post-surgery resected bowel. And I think this lets you know from India.
Can you not feel that once it gets to an extent?
Yeah, I think there's abdominal pain and distension and that kind of thing. I think, yeah, I think you're suffering through this. Yes. Okay. So again, the adult worms may pierce the bowel wall, migrate out of the GI tract, leading to peritonitis. In response, we got fever, or in response to fever. So if you start running a fever, they exit. Okay, they get out of the GI tract. Certain drugs would force them out, and some anesthetics would force them out. So again, I hope at this point of lab you are very familiar with our choice of specimen of the stool and a direct wet mount. I think we're good on that. I think y'all have really come a long way in 2 weeks with that. All right. Enterobius vermicularis, another intestinal nematode. These are the pinworms. Okay, so what was our first one? What do we call the first one? The human roundworm, right? Makes sense. Got a big roundworm in our intestine. Now we've got pinworms. The infective stage, again, is embryonated egg. And we get this from ingestion through hand-to-mouth transfer. So, right, picking up things or wiping, you know, yeah. Perianal region is the source of eggs. So what happens? The eggs are laid outside. The eggs are in the perianal region, not inside the small intestine. They're out. Okay, so we see contaminated clothing and bedding with eggs. Airborne transmission is also possible. So, you know, think about flipping a sheet. That's the way I always think about it. You know, somebody's been laying in that bed and they're got eggs and they're in the sheets now. You flip it up. No, you know, y'all never done that. When you make your bed, you don't pop the sheet and fill the air. That could be airborne transmission. I was just thinking how that would happen. The infection can easily be spread by person to person under crowded conditions. Again, this is what where a big problem is crowded conditions, poor sanitation, until all members of the family are infected. Eggs hatch in the intestine and adults develop from the embryo and become established in the large intestine where mating occurs. Okay. Gravid females, what's gravid? Anybody? Yeah. Is that a term you're unfamiliar with? Okay. That's why we pause. Anybody got a guess?
It means pregnant.
Yeah. Yeah, I was hoping that, yeah. Yes, pregnant female. Migrate out of the anus. They exit. They deposit their eggs outside at around perianal, around the anus. So here's our picture here. So we said that we'll start with one, right? So here is our egg in the perianal region. They're in the perianal folds. The larva is inside egg. The larva right here inside the egg matures within 4 to 6 hours. So this is not a 3-week, hey, you got to wait around and got to dump out and hang on till somebody picks me up 3 weeks from now and then ingests me, right? So that's our diagnostic stage. This is the infectious age. Embryonated egg gets ingested, sorry. And then it goes in, and where does it like to go again? So the larva hatch in the small intestine, and then in the large intestine, the adults in the lumen of the cecum. Here's our male, here's our female. The gravid female migrates to the perianal region at night to lay eggs. So this is pinworm, right? Isn't that what we said? So Enterobius verbicularis, in some cases, females may dry out and explode, releasing all their embryonated eggs, which are fully infected within a few hours, right? Not 3 weeks. Eggs remain viable outside the body of the host in conditions of high humidity and moderate temperatures. So pretty much in the house, we're good. The adult female, 8 to 13 millimeters in length. That's millimeters, so what do you think? What's this one compared to our roundworm? It's not a foot long, right? These are millimeters. Not 20 centimeters, not 12 inches, right? So a lot smaller, a lot shorter pinworm. That's the name. The eggs, 50 to 60 microns. So what size is that? Have we seen these already? Have we seen the pinworm? I don't know if we've seen the pinworm. Like we have. Operculum, none. Shell thickness is moderate. Embryonated, yes, because it doesn't come out until the female is impregnated. And impregnated means she's got embryonated eggs. Flattened sides, so this is going to be a neat one. I think we have Enterobius verbicularis. I'm hoping. I think I've seen it on my list. Because this is it's pretty unique. It's pretty easy to see too. Got this almost like a center groove, real thick outer wall. And they're just folded up in there. That's what it is, if you want to think of it. So Enterobius verbicularis is a non-pathogen, yay. Asymptomatic infections are most common. Hypersensitivity reactions are associated with intense itching in the perianal region. Pruritus ani, official name there. And we've all, maybe you had no, I mean, eventually you're going to see that. And eventually you're going to see somebody that can't quit scratching their butt. Basically, it's a good way to put it. Okay, and it may be because of this. They got pinworm infection. Okay, and that's it. That's the only way you know they may have it. So we're going to demonstrate it by a procedure of choice called the pinworm paddle. And Dr. Walls was up here earlier making fun of my Scotch tape test. Okay, because that's usually where you hear about the Scotch tape, is that, you know, doctors may tell you if you suspect a pinworm infection is you put tape over the perianal region, over the anus, right, opening. And then when the female comes out, it sticks to the tape and you pull it and you see that you got pinworm infection. Yay, isn't that fun? So we do a pinworm paddle. So kind of want to, I don't think I have a pic, no, I don't have a picture here. So what I want to do is I'm going to head to Google right quick so you can see a pinworm paddle. Has anybody ever has looked that up yet? Pinworm paddle. Okay. So it's, you know, it looks professional, right? It looks pretty fun there. Okay, this is ARUP lab. So what do you think we're gonna, oh, here it is. Here's a good picture. I was gonna say, I was hoping we had a picture of the demonstrating the procedure. Okay. So pinworm paddle, that's using cellulose tape. Okay. I don't know don't know if that's exactly what I want to see. So basically, the paddle's going to be sticky, right? All right. Yeah, everybody think that's good, or we need to do more with the pinworm paddle test? You good? All right. Good. So go back. All right. So the adult female again, seen in the perianal region on the surface of the stool. So you can look at the stool, see the female. Eggs are rarely seen in the stool because females do not release eggs until they have exited the anus. Okay, so those eggs aren't going to be in the feces. They're going to be around on the person. All right. We good? Y'all good? Okay, so trichuria is, we've seen this one, right? Who wants to describe it before we even get there? What does the egg look like for trichuria? We've seen it since like day one in lab, right? Very first one we put up, like, ooh, look, there it is. I think it was in the pseudoparasite lab. Y'all remember? So trichurious is the whipworm. So we've gone from roundworm to pinworm, now the whipworm, and you're gonna see why it's called the whipworm when it becomes an adult, looks like a whip, all right? Indiana Jones, start thinking that way. You remember Indiana Jones had a whip on its belt? Everybody seen Indiana Jones and the temples and all that? Okay. So the infective stage is the embryonated egg, common theme, right? The adults, the thin attenuated anterior end is embedded in the intestinal mucosa. Okay, that's pretty graphic. The thickened posterior portion extends into the lumen of the intestinal lumen. So they're gonna latch on, okay? Female produces eggs, which are passed in the feces. Unembryonated eggs require 10 days in the dirt to mature. So outside the body, we need 10 days. So we've gone from 3 weeks to a couple hours, all right, to now 10 days. So that's definitely will probably be in your charts that we got in this unit that you can review and put those together. Tables, I guess is what we call them. So there is the whipworm. Anybody want to guess who the male and the female are here? There's two. Don't know if you can see this one right there. No guesses yet? Okay. Yeah. Okay. There it is. Here's our trichurious life cycle from the CDC. Again, you've seen this double headed egg, you want to call it that. So we'll start here with the diagnostic stage is the unembryonated egg passed in the feces. How long does it need to be out of the body before it comes back? How many days? 10 days. 10 days. So you're going to see that egg dividing in those 10 days into a 2-cell stage. You're going to see much more dividing in here, the advanced cleavage, and then you're going to see embryonated egg, which has the little guy inside. So this is where it needs to be before it goes back in to the next host. Not that you're going to be continually infecting yourself. You could. Goes down, okay? The larva hatch in the small intestine. They're in the middle. And then the adults are in the large intestine. So we got 2 large whipworms. Here is the female. Here is the male. So sure what we got. All right. So let's look. The egg is barrel shaped or football shaped, 50 to 54 microns in size. Operculum still none. So we keep seeing that. That's been a common trend all the way through all these eggs so far. The operculums are none. Shell thickness moderate. Embryonated, no. Color, bile. And we have the bipolar plug. So the plugs on both ends of the football is the way we see it. We've seen this from day one. Not to be confused with who? Who does it get confused with in the pseudoparasite family? Diatom. There's one even better than the diatom. Diatom has the shape, but who has the bipolar plug look to it. Remember? Anybody remember that?
Is that the pollinator?
One of the pollens, yes, in particular the, there you go, bee pollen, but it's not plugged on both symmetrical, it's kind of turned up this way. Right? So there we are. Boom, boom. Two plugs, two plugs, two plugs. It almost looks like our mask, doesn't it? With the little ear loops there on the side. That'd be a good mask, wouldn't it? All right, tricurious disease, light infections, asymptomatic, heavy infections associated with abdominal pain, distension, bloody and mucoid diarrhea. Tenesmus. What is tenesmus? Tenesmus. Somebody help me out with that. That's a new word for me, so what it must be a new word for you.
Refers to the cramping,
Cramping.
rectal pain.
Rectal pain. Cramping or the rectal pain? Which one?
Oh,
All of it, right? Tenesmus. So have you ever had, I think we've all had cramping and rectal pain, right? So now we have a new word, tenesmus. Edema of the rectum may lead to a prolapsed rectum. And if you've never seen a prolapsed rectum on a patient, that means it's basically pushed out instead of in where it should be. Okay, so you can see that for different reasons. That's definitely one of them. So we, of course, we have graphic material coming. Viewer discretion is advised. And that is a prolapsed rectum. There. So here we got eggs, we got these adults. And this one's called which one again? This is the whip, right? Whipworm. Yeah. See the eggs. I mean, not eggs, you can see the worms actually. Worms again.
What is the meat book?
What is that?
The intestine?
That is your rectum. Has extruded out of the anus and is outside the body now instead of inside the body.
Get rid of them like that.
Yeah. How do we find it? Easy, right? Stool. We've already done this. Direct wet mount. Yay. Tricurious. So we had the round worms. We've had the tin worms. We've had the whipworms, and now we're at the hookworms. How many of you have dogs and cats? Okay, good. Have you ever been asked to look by the vet, look at the poop, see if you see any white worms hanging out in that poop sample? Because that's where most of what you're working with in the lab downstairs is from animals. Those aren't human feces, those are animal feces. So sometimes you'll know, right? Perianal itching, your dog does what? Scoots across the carpet with the legs in the air, right? Okay, so you can also look at the poop or look and see strings of little worms hanging out or in the poop itself. It's a good indication you need to go get your dog wormed, and that's what they do when they take that fecal loop in and come out. They're just wanting to get a feces specimen to see if it has any adult worms on it. The hookworm, Ancylostoma duodenale, old hookworm, Europe, Mediterranean, west coast of South America. The Necator americanus, the New World hookworm, is in North America, South America, and Africa. Both organisms can be found in India, Southeast Asia, and the South Pacific Islands. So that's our geographical distribution of hookworms. So if you were like, okay, so I work in North America, so if I find a hookworm, it's probably going to be who? Necator americanus, correct. The life cycle, eggs are in the stool or unembryonated or in early cleavage stage. And we got this like immature larva, and we're going to call him rhabditiform. Within the egg or after 24 to 48 hours, they hatch in the soil. Then we have the filariform larva, which develop from the rhabditiform larva of the infective stage. Oh, the filariform is the infective stage. Sorry, don't mess that up, right? The rhabditiform is not the infective stage. It has to develop into the filariform. Warm, moist soil is ideal for habitat, suitable host, until a suitable host can be found. The route of transmission, it penetrates the skin. So we're not ingesting this one. This hookworm kind of gets its name from this. It's going to hook you, right? In the area of the skin, it makes contact if you're walking in this soil that's contaminated. Most likely the feet. The larvae are carried, then it gets in, it penetrates your skin into your foot. Then it's going to migrate to the lungs. That's going to in the blood. The larvae enter the alveoli. Once they get to the lung, they migrate up the trachea, and you cough and swallow, and they come into the intestine. The adults attach to the lining of the intestines. The female produce their eggs, which are passed in the stool. Familiar. Should sound familiar, this route of transmission. So here is our CDC. Infective stage penetrates your foot. More than likely, the filariform larvae, here they are in the soil waiting on you to step in there, and penetrates. Then from your foot, they're going to get into the bloodstream and end up in the lungs. From the lungs, they're going to go up to through the trachea, up to the esophagus, and down back into the intestine, where you find the adults in the small intestine, and then you have the eggs and the feces, unembryonated, right? So this is our diagnostic stage. The unembryonated egg turns into the rhabditiform larvae, filariform larvae hatch out, penetrate skin, and we're into a new host. So this is from looks like the intestine, because I see a lot of villi, small intestine, and it's hooked on, the adults are. So how do we tell the difference between the Ancylostoma duodenal alley, duodenal? How do you want to say that? Duodenale? Y'all like that? Or do y'all like duodenal or duodenal? I like duodenale, so I can spell it. So I like to go with it again. The Ancylostoma has 4 teeth in the mouth region, the latch-on part, has 4 teeth. The Necator americanus, the one we said we may probably see more than likely in North America, has 2 cutting plates. So the Ancylostoma looks more evil when we see the picture here. And the Necator, it just has this like open and close kind of, kind of blade look to it. So here is the 4 teeth. So who is this? Ancylostoma. Okay, so you're gonna have to know that when we do this on the click-through slideshow when y'all take the midterm and the finals. Again, teeth. See the teeth? So here is the Necator. So this is its teeth. It's kind of a blade look to it instead of the sharpness to it. Still gonna latch on. They're 55 to 75 microns in size. Still no operculum. The shell thickness is very thin. Unembryated or early cleavage stage. Colorless, very thin shell. So here we have seen this too. I know somebody has seen the worm egg, right? I think we did, didn't we? Somebody who's, you don't have to raise me. I know somebody identified the hookworm with the help of Miss Farmer, I think. I remember. Yeah, it was where it wasn't supposed to be. It was just in the stool. She was like, oh. Again. Diarrhea, severe blood loss, with heavy infections leading to anemia. Again, demonstrate this in the soil. Direct wet mount. All right. So how are we doing on time? Good?
9:43.
9:40. Well, we got plenty of time. All right, so that was the hookworm. So that puts us way over here. Yep. Next, got a couple more pages to go, right? Cutaneous larval migraines. Cutaneous larval migraines. So this is associated with penetration of the skin. So we just had one, right? Ancylostoma duodenale, right? That was the human. So now we're going to see Ancylostoma canium or Ancylostoma brasiliensis. And that's dog and cat hookworms. That's why we brought the dog and cat into the conversation earlier. The larva cannot complete development, so they migrate through the subcutaneous tissue. Severe allergic reactions lead to intense itching. Human infection is acquired by, you guessed it, dog and cat feces, contact with that. So, how could that ever happen? All right. Walk outside barefoot and you just happen to step in a big pile of dog poop. Or what? Your cat likes to use your flower bed and you like to go in there and do your gardening barefooted as you garden up plant your new flowers for spring, and you've got cat poop all in your flower bed. No? Nobody has that problem? My neighbor once called me and told me that my cat was using her flower bed to poop in and she'd like it to stop. I said, well, I'm gonna try my best, but I don't know if I can go grab my cat when she's over there scratching in your flower bed. But what I had to do was I gave my cat a year-round litter box. I used to take it away like when she was like in the summer when she wasn't needing it and wasn't in the garage as much. I took it away. So we had to do a year-round. That helped. That kept her out of the neighbor's flower bed. Larva. So dog and cat feces. So here's our CDC. Here's our buddies here, our dog and cat. Right? They're shedding it. They're shedding the eggs and the feces. Okay, so we got the rabidiform larva hatches out of that egg, and then the adult's sitting there in the environment, and it can invade us through our skin, and either your hands and arms or your legs. Okay. So how is it going to keep the process going with the cat and dog? Because this is over here, right? How's this going to happen? These are our hosts, right? So again, penetration. Here's brasiliensis. Here's an infection, invasion, cutaneous. All right. That brings us to the Trichostrongylus species. And this one, a parasite of herbivores. And does everybody know what a herbivore is? An animal that eats grass, right? So our horses and cows and sheep and goats. And eggs, which are passed in the feces, contaminate the soil. Humans here are the accidental host through ingestion of that larva, not skin penetration. How in the world could that happen? How could a human accidentally ingest a larva out of feces into a pasture, right? And who hasn't reached down and grabbed a weed and chewed on it from out in the field? No? Nobody's done that? Nobody? Remember there was a football coach that used to eat grass during the game too, so you never know. Larvae attach directly to the intestine. There is no migration to the lungs. Heavy infection is associated with significant blood loss. So here's our herbivore. Adult worms in the gut of the herbivore. Okay, so that herbivore is going to poop onto the grass, and the eggs are going to hatch in that poop. The larvae are going to move on to the grass, and then somebody's going to pick up a weed and chew on it just because it was fun, and you're going to get infected. Trichostrongylus. Adult worms resemble the human hookworm, and eggs resemble human hookworm eggs, except they are larger and have more pointed ends. So again, a larger egg than the human hookworm egg. Ooh, who's this down here at the bottom?
Like here.
Yeah. Okay, so here is our side by side. This is the adult hookworm egg. This is the Trichostrongylus. Adult hookworm egg, Trichostrongylus. So side by side comparison, very, very, I would say impossible to detect the difference, but eventually you're going to get there. Strongyloides, Stercoralis. Strongyloides, this is the threadworm. So I'm kind of wrapping it up. This is our threadworm. The difference from the human hookworm is a more free-living generations. We have the, sorry, Siri's trying to talk to me. I'm checking the time. More free-living parasitic males have not been demonstrated. Females burrow into the intestinal mucosa where they deposit their eggs. Eggs develop in the mucosa of the intestine, larvae hatch, migrate into the lumen of the intestine or passed out of the feces. The rhabditiform larvae become filariaform larvae in the soil. Threadworm. That is a, not sure what that section is. Anybody remember their gross microanatomy? So we got the Strongyloides. All kinds of, yeah, all right? So we can get an auto infection. And this is, again, the egg resembles the hookworm eggs, except they're embryonated. The rhabditiform larvae, hookworm, large buccal cavity. So this is going to be key. We're going to finish up with these pictures of the hookworm, long buccal cavity versus the Strongyloides, short buccal cavity. And that's what Strongyloides stercoralis equals short. So here is the hookworm, rhabditiform larvae. And this is what we're talking about. This is where we're focused right here. Everybody see that arrow moving back right in here? So again, the hookworm, long. And here's the Strongyloides, short. Okay, that's the difference. Short. I think it's here, hard to see. Short versus long. Do we see this with immunocompromised host? Migrating larvae invade many different tissues. We demonstrate this with either stool or sputum. Anisakaiasis, right? Anisakaiasis, simplex, and Pseudoterra nova decipiens, roundworms of marine mammals. So if you go into marine biology and you're going to work with dolphins somewhere, you may want to pay attention here of anisakaiasis. The human infection is acquired through ingestion of raw or pickled fish. We would never eat raw fish, right? Anybody had raw tuna? Yeah, maybe, right? Larvae may be found vomitous or during procedures such as gastroscopic or surgery. We saw this. This is Japan sees about 2,000 to 3,000 cases, of course, right? Sushi. Scholars generally consider anisakaiasis both underestimated and underdiagnosed. They see 8,000 annual cases in Spain due to consumption of raw or marinated anchovies. Hey, all right, hope you don't like anchovies. Though treatment is not always necessary, removal by endoscopy may be necessary. So you may have to go in there and actually pull the parasite surgically. Ugh. Some people experience a tingling sensation while eating raw or undercooked fish or squid. This is actually the worm moving in your mouth or throat. Pseudoterra nova species. Here he is. There's our dolphin. Here's, that looks like a tuna, right? Is that a tuna? Here's our little free swimming larvae ingested by the crustaceans. The crustaceans eaten by the bigger fish. The bigger fish is eaten by the bigger fish or the bigger mammal. You can see how it works its way through its stages. All right. You made it through the intestinal nematodes. We'll end the meeting and see y'all in lab tomorrow, right?
Wipes.
Huh?
Wipes.
Wipes, yes. Let me end this right quick.